breathe calmly, and feel peace. Today we're discussing how to reduce redness and swelling naturally, those uncomfortable, visible signs of inflammation that make skin feel and look irritated. Redness and swelling in your skin indicate inflammation, your body's response to perceived threats or damage. While some inflammation is part of healing, excessive or chronic inflammation creates discomfort and can damage skin over time. Let's explore natural, gentle ways to calm this inflammation. Understanding what causes redness and swelling helps you address it effectively. Inflammation can result from active acne or breakouts, irritation from harsh products or treatments, allergic reactions to ingredients, environmental stress like sun, wind, or extreme temperatures, compromised skin barrier, underlying conditions like rosacea or eczema, and stress, which triggers inflammatory responses throughout your body. The natural approach to reducing inflammation combines topical soothing treatments, lifestyle modifications, and patience for your body's healing processes. Cool temperature is one of the most immediate, natural anti-inflammatory tools. Cold constricts blood vessels, reducing blood flow to inflamed areas, which decreases redness and swelling. It also numbs discomfort and provides immediate relief. Apply cold compresses for 5 to 10 minutes several times daily. Wrap ice or a cold pack in a soft cloth. Never apply ice directly to skin. Hold gently against red, swollen areas. The cold brings quick, temporary relief and reduces inflammation over time with consistent use. Keep aloe vera gel in your refrigerator. Cold aloe applied to inflamed skin provides both the anti-inflammatory benefits of aloe and the soothing effect of coolness. Green tea is powerfully anti-inflammatory. Brew green tea. Let it cool completely, then soak a soft cloth in it. Apply the cloth as a compress to inflamed areas for 10 minutes. The polyphenols in green tea reduce inflammation naturally. You can also use cooled green tea bags directly on inflamed spots. Place them on closed eyes for puffiness or on facial inflammation for relief. Chamomile has natural anti-inflammatory and calming properties. Brew chamomile tea, cool it completely, and use as a compress just like green tea. Chamomile is especially gentle and suitable for sensitive skin. Oatmeal is soothing and anti-inflammatory. Mix colloidal oatmeal with cool water to form a paste. Apply to inflamed areas for 15 to 20 minutes, then rinse gently. This is particularly effective for widespread redness or irritation. Aloe vera gel, as mentioned, is naturally anti-inflammatory and soothing. Apply pure aloe gel to red, swollen areas 2 to 3 times daily. The cooling, moisturizing effect calms inflammation while supporting healing. Cucumber has mild anti-inflammatory properties and cooling effects. Chill cucumber slices in the refrigerator, then place on inflamed areas for 10 to 15 minutes. This is refreshing and gently soothing, though less potent than other methods. Honey, particularly raw honey, has anti-inflammatory and antibacterial properties. Apply a thin layer of honey to inflamed areas as a mask for 15–20 minutes. Then rinse with cool water. Manuka honey is especially beneficial, but regular raw honey works too. Turmeric is powerfully anti-inflammatory due to its curcumin content. Mix a small amount of turmeric powder with yogurt or honey to form a paste. Apply to inflamed areas for 10 to 15 minutes, then rinse. Be aware turmeric temporarily stains skin yellow. This fades quickly. Beyond topical treatments, internal approaches support inflammation reduction. Omega-3 fatty acids found in fatty fish, walnuts, flax seeds, and fish oil supplements are potently anti-inflammatory. Regular consumption helps reduce systemic inflammation, including in your skin. Antioxidant-rich foods fight inflammation from within. Eat plenty of berries, leafy greens, colorful vegetables, green tea, and other antioxidant sources. These compounds neutralize inflammatory molecules throughout your body. Stay well hydrated. Water supports all bodily functions, including inflammatory responses and healing. Drink water consistently throughout the day. Reduce inflammatory foods. Sugar, excessive alcohol, and highly processed foods can increase inflammation. You don't need perfection, but generally choosing whole, unprocessed foods supports reduced inflammation. Stress management is crucial because stress hormones trigger and worsen inflammation throughout your body, including your skin. Practice daily stress reduction. Meditation, deep breathing, gentle exercise, time in nature, creative activities, or whatever genuinely calms you. Sleep adequately. During sleep, your body performs essential anti-inflammatory processes. Chronic sleep deprivation increases inflammatory markers throughout your body. Prioritize 7 to 9 hours nightly. Gentle exercise reduces inflammation through multiple mechanisms, reducing stress, improving circulation, supporting immune function. However, very intense exercise can temporarily increase inflammation, so moderate, regular activity is ideal during flare-ups. Avoid triggers that worsen your specific inflammation. If hot showers increase redness, use lukewarm water. If certain foods trigger redness, avoid them. If stress causes flare-ups, intensify stress management during stressful periods. Protect inflamed skin from sun exposure. UV radiation worsens inflammation dramatically. Use gentle mineral sunscreen or physical sun protection like hats. Simplify your skincare during inflammatory flares. Use only the gentlest products, fragrance-free, minimal ingredients. Avoid all actives and potential irritants until inflammation calms. Use skincare ingredients known for calming inflammation. Niacinamide reduces inflammation and supports barrier function. Centella asiatica is traditionally used for calming inflamed skin. Green tea extract applied topically mirrors the benefits of green tea compresses, and licorice root extract has natural anti-inflammatory properties. Be patient. Inflammation doesn't disappear overnight. Natural methods work gently over days to weeks. Consistency matters more than intensity. However, know when natural methods aren't sufficient. If inflammation is severe, spreading, or accompanied by pain, fever, or other concerning symptoms, see a healthcare provider. If redness and swelling are chronic despite gentle care, you may have an underlying condition like rosacea that needs professional diagnosis and treatment. Prescription anti-inflammatory treatments, topical steroids, azelaic acid, metronidazole for rosacea may be necessary for some people. Natural methods can complement medical treatment but shouldn't replace it when needed. For chronic inflammation, work with a dermatologist to identify the root cause rather than just managing symptoms. As we close, remember, reducing inflammation naturally requires multiple approaches: topical soothing treatments, anti-inflammatory lifestyle practices, stress management, and patience. Your body knows how to resolve inflammation when supported properly. May your redness fade gently. May swelling resolve completely. May your skin return to calm comfort. Thank you for this. Welcome to this understanding, compassionate space. Breathe deeply and know you're not alone. Today we're talking about hormonal acne, those frustrating breakouts that seem to appear on a schedule, often resistant to typical treatments. Let's explore how to manage hormonal acne gently and effectively. Hormonal acne is deeply connected to your body's internal rhythms and cycles. It typically appears along your jawline, chin, and lower cheeks, though it can occur anywhere. For many people, it flares predictably before menstruation, during ovulation, during pregnancy, or during other hormonal shifts. Understanding this connection helps you approach it with patience rather than frustration. Hormones, particularly androgens like testosterone, influence sebum production. When these hormones fluctuate or increase, your oil glands produce more sebum, leading to clogged pores and breakouts. This is why hormonal acne often begins or worsens during puberty, pregnancy, menstrual cycles, perimenopause, or when starting or stopping hormonal birth control. The gentle approach to hormonal acne combines appropriate topical care with lifestyle support and, when necessary, internal treatments. Because hormonal acne is driven by internal factors, topical treatments alone often aren't sufficient, but they're still an important part of management. For topical care, establish a gentle routine with proven acne-fighting ingredients. Cleanse once daily with a gentle cleanser, preferably one containing salicylic acid to help keep pores clear. In the morning, rinse with water or use a very light cleanse. Use topical retinoids, which are particularly effective for hormonal acne. Over-the-counter adapalene or prescription tretinoin increase cell turnover, preventing pores from clogging and reducing inflammation. Start with 2 to 3 applications per week and gradually increase as tolerated. Always use sunscreen the next day. Benzoyl peroxide spot treatments can help with active breakouts by killing bacteria and reducing inflammation. Use 2.5% concentration to minimize irritation. Niacinamide is beautifully supportive for hormonal acne. It helps regulate oil production, reduces inflammation, and supports barrier function. A serum or moisturizer with 5% niacinamide can be used twice daily. Azelaic acid addresses both active acne and post-inflammatory marks. It's gentle enough for daily use and works well for hormonal patterns. Always moisturize, even with oily, acne-prone skin. Use lightweight, non-comedogenic formulas. Well-hydrated skin with a healthy barrier responds better to treatment. Sun protection is essential, especially when using retinoids or other sensitizing treatments. Choose oil-free, non-comedogenic sunscreen. Now let's discuss internal approaches to hormonal acne. Since hormonal acne is driven by internal hormone fluctuations, addressing the internal aspect is often necessary for significant improvement. For those who menstruate, certain oral contraceptives can help regulate hormones and reduce acne. Pills containing estrogen and specific progestins, like drospirenone, are FDA approved for acne treatment. Discuss this option with your healthcare provider if it's appropriate for you. Spironolactone is a medication that blocks androgen receptors, reducing the hormonal trigger for acne. It's particularly effective for adult women with hormonal acne. Discuss with a dermatologist whether this might be appropriate for you. It requires monitoring and isn't suitable for everyone, but for many people, it's genuinely life-changing. For severe hormonal acne not responding to other treatments, isotretinoin, Accutane, may be considered. This powerful medication requires careful monitoring and has significant side effects, but it can provide lasting improvement for severe cases. Lifestyle factors significantly influence hormonal balance and thus hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques daily. Meditation, deep breathing, yoga, time in nature, creative expression, or whatever genuinely calms you. Sleep adequately. Sleep deprivation disrupts hormonal balance and increases stress hormones. Aim for 7-9 hours nightly with consistent sleep times. Exercise regularly, but not excessively. Moderate exercise helps regulate hormones and reduce stress. However, excessive intense exercise can actually worsen hormonal imbalance in some people. Eat a balanced anti-inflammatory diet. Some research suggests that high glycemic foods and dairy may worsen hormonal acne for some people. Consider trying a lower glycemic diet or eliminating dairy for 6 to 8 weeks to see if it helps. Include foods that support hormone balance. omega-3 rich fish, fiber for helping eliminate excess hormones, antioxidant-rich vegetables and fruits, and adequate protein. Stay well hydrated. Water supports all bodily functions, including hormone regulation and skin health. Consider supplements that may support hormonal balance, though always consult a healthcare provider first. Some people find benefit from omega-3 fatty acids, zinc, evening primrose oil, or DEEM, dindolylmethane. However, supplements aren't regulated as strictly as medications, and effectiveness varies. Track your cycle and your breakouts. If you menstruate, note when in your cycle breakouts occur. This pattern helps you understand your hormonal acne and can guide treatment timing. Some people intensify topical treatments during their high breakout phase of their cycle. Be especially gentle during hormonal flare periods. Your skin is more reactive and sensitive during these times. Avoid introducing new products or harsh treatments right before or during your period. Limit dairy consumption. While the connection isn't proven for everyone, many people find their hormonal acne improves when they reduce or eliminate dairy, particularly milk. The hormones naturally present in dairy may contribute to breakouts in susceptible individuals. Avoid touching your face, which transfers bacteria and oil. This is especially important during hormonal breakout periods when your skin is more vulnerable. Keep everything that touches your face clean. Pillowcases, phone, makeup brushes. Change pillowcases every 2 to 3 days during active breakouts. Don't pick at hormonal acne. Deep hormonal breakouts are particularly prone to scarring when picked. Keep your hands away no matter how tempting. Be patient with treatment. Hormonal acne often takes longer to respond to treatment than other types. Expect 3 to 6 months before seeing significant improvement. Hormonal treatments in particular take time to regulate hormone levels and show effects on your skin. Understand that hormonal acne may not be completely curable, but it's highly manageable. Even with good treatment, you may have some breakouts during hormonal fluctuations. The goal is significant improvement, not perfection. For severe or persistent hormonal acne, work with a dermatologist. They can prescribe stronger topical treatments, recommend hormonal therapies, or discuss systemic options. Professional guidance is valuable for stubborn hormonal acne. Remember that hormonal acne is not your fault. It's not caused by poor hygiene or inadequate skin care. It's your body responding to internal hormonal signals. Treat yourself with compassion, not judgment. As we close, remember, hormonal acne requires patience, comprehensive care addressing both external and internal factors, and self-compassion. With appropriate treatment and lifestyle support, significant improvement is possible. May your hormones find balance. May your skin clear and heal. May you treat yourself gently through hormonal fluctuations. Thank you for this time together. Manage your hormonal acne with patience and comprehensive care.
Gentle skincare is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products.
Welcome, and take a moment to settle into this peaceful space. Breathe deeply and let go of any tension. Today we're going to explore one of skincare's most celebrated hydrating ingredients, hyaluronic acid. The name might sound intimidating. Acid can evoke thoughts of harsh, aggressive treatments. But hyaluronic acid is nothing like that. It's one of the gentlest, most hydrating ingredients you can use on your skin. In fact, it's already naturally present in your body, making it wonderfully compatible with your skin. Let's begin by understanding what hyaluronic acid actually is and why it's so remarkable. Hyaluronic acid is a molecule that your body naturally produces and uses in various tissues, including your skin, joints, and eyes. Its superpower is its ability to hold water, an astonishing amount of water. One molecule of hyaluronic acid can hold up to 1,000 times its weight in water. Imagine that, a single molecule acting like a tiny sponge, attracting and retaining moisture. In your skin, natural hyaluronic acid helps maintain hydration, plumpness, and suppleness. It fills the spaces between collagen and elastin fibers, creating a cushioned, hydrated environment where your skin cells can thrive. When your skin has adequate hyaluronic acid, it looks plump, smooth, and radiant. Unfortunately, as you age, your natural production of hyaluronic acid decreases. Starting in your 20s and accelerating through your 30s and and beyond, your skin gradually produces less of this vital molecule. This is one reason why skin tends to look less plump and more dehydrated as we age. The good news? You can supplement your skin's hyaluronic acid through topical application, helping restore that youthful hydration and plumpness. Now let's talk about what hyaluronic acid does when you apply it to your skin. First and foremost, it's a humectant. Humectants are ingredients that attract water from their surroundings and bind it to your skin. When you apply hyaluronic acid, it draws moisture from the air and from deeper layers of your skin, bringing hydration to the surface where you can see and feel the benefits. This immediate hydrating effect is why hyaluronic acid feels so instantly gratifying. Within minutes of application, your skin feels more supple, looks more plump, and appears more radiant. This isn't just superficial. You're actually increasing the water content in your skin. Hydrated skin functions better in every way. When your skin cells are properly hydrated, they can carry out their normal processes more efficiently. Cell turnover improves, barrier function strengthens, and even oil production can normalize. Hydration is truly foundational to healthy skin. Second, hyaluronic acid helps reduce the appearance of fine lines and wrinkles. When your skin is dehydrated, fine lines become more prominent. Think of a plump grape versus a raisin. Both are the same fruit, but one has lost its water content and become wrinkled. By flooding your skin with hydration, hyaluronic acid temporarily plumps up those fine lines, making them less visible. This is especially noticeable around the eyes and mouth, where expression lines tend to form. While this effect is temporary, the hyaluronic acid must be reapplied regularly to maintain results. With consistent use, you can maintain that plumped, smooth appearance. Third, hyaluronic acid supports your skin barrier. A well-hydrated barrier is a strong barrier. When your skin is adequately hydrated, the lipids and cells that make up your barrier can arrange themselves properly, creating better protection against environmental stressors and reducing water loss. Think of your skin barrier like a brick wall. If the bricks are dry and brittle, the wall is weak. But if they're well maintained and properly moisturized, the wall is strong and protective. Hyaluronic acid helps keep those bricks in optimal condition. Fourth, hyaluronic acid has a soothing effect on the skin. While it's not specifically an anti-inflammatory ingredient, the act of deeply hydrating your skin can reduce irritation and discomfort. Dehydrated skin is often sensitive, tight, and uncomfortable. Restoring hydration naturally calms these sensations. Fifth, hyaluronic acid works for every skin type. Whether you have dry, oily, combination, sensitive, or mature skin, hyaluronic acid offers benefits. It's lightweight and non-greasy, making it perfect for oily skin. It provides deep hydration that dry skin desperately needs. It's gentle enough for sensitive skin, and it addresses the dehydration that comes with aging. This universal compatibility is one reason hyaluronic acid has become such a staple in skincare. It's rare to find an ingredient that truly works for everyone, but hyaluronic acid is one of them. Now, let's talk about molecular weight and why it matters when choosing hyaluronic acid products. Hyaluronic acid comes in different molecular sizes: high molecular weight, medium molecular weight, and low molecular weight. Each size has different properties and benefits. High molecular weight hyaluronic acid has large molecules that sit on top of your skin. They can't penetrate deeply, but they create a beautiful, hydrating film on your skin's surface. This surface hydration feels immediately comfortable and helps prevent water loss. It's like placing a moisture-locking blanket over your skin. Low molecular weight hyaluronic acid has smaller molecules that can penetrate more deeply into your skin. They deliver hydration to deeper layers, providing more lasting effects and working from within to plump and hydrate. Many modern hyaluronic acid products use a blend of different molecular weights, giving you both immediate surface hydration and deeper, longer-lasting effects. This is ideal because you get the instant gratification of surface moisture, plus the cumulative benefits of deep hydration. When shopping for hyaluronic acid products, look for those that specify they use multiple molecular weights or list different forms like sodium hyaluronate, which is a salt form of hyaluronic acid with smaller molecular size. Let's discuss how to use hyaluronic acid effectively in your routine. Timing is important with hyaluronic acid. Because it's a humectant that draws water from its surroundings, you want to apply it when there's moisture available to draw. This means applying it to damp skin. After cleansing, while your skin is still slightly damp, is the perfect time to apply hyaluronic acid. That surface moisture gives the hyaluronic acid water to bind to. If you apply it to completely dry skin, it might actually draw water from deeper layers of your skin, which can be counterproductive. Some people like to mist their face with water or a hydrating toner before applying hyaluronic acid, then mist again after. This sandwich technique ensures there's plenty of water for the hyaluronic acid to grab onto. After applying hyaluronic acid, it's crucial to seal it in with a moisturizer. Remember, hyaluronic acid is a humectant, not an occlusive. It draws water to your skin, but doesn't prevent it from evaporating away. You need to lock in that hydration with a cream or lotion that contains occlusive ingredients. Think of it as filling a bucket with water, hyaluronic acid bringing hydration, and then putting a lid on it, moisturizer preventing evaporation. Both steps are necessary for optimal hydration. You can use hyaluronic acid both morning and night. It layers beautifully under sunscreen in the morning and under heavier night creams in the evening. Many people apply it after cleansing and toning, before serums and moisturizers. Hyaluronic acid is also available in different product types: serums, essences, moisturizers, and even sheet masks. Serums tend to have higher concentrations and allow for more precise layering with other products. Moisturizers with hyaluronic acid give you hydration and occlusion in one step, which is convenient. The concentration of hyaluronic acid in products typically ranges from 0.1% to 2%. You don't need extremely high concentrations to see benefits. Even lower percentages are effective when formulated properly. One important consideration: climate matters when using hyaluronic acid. In humid environments, hyaluronic acid has plenty of water vapor in the air to draw from, making it extremely effective. But in very dry environments, think desert climates or heated indoor spaces in winter, there may not be enough moisture in the air for hyaluronic acid to bind. In these dry conditions, hyaluronic acid might draw water from deeper layers of your skin instead of the environment, potentially leading to increased dehydration. The solution is simple. Use a humidifier to add moisture to the air. Apply hyaluronic acid to damp skin with an occlusive moisturizer on top, or consider using it in combination with other hydrating ingredients that work differently. Are there any downsides to hyaluronic acid? Very few. It's extremely well tolerated, and allergic reactions are rare. Some people with very sensitive skin might react to certain formulations, but this is usually due to other ingredients in the product rather than the hyaluronic acid itself. One thing to be aware of: some lower quality hyaluronic acid products can feel sticky or pill up under other products. This is usually a formulation issue, not a problem with hyaluronic acid itself. If you find your product feels uncomfortable, try a different brand. Hyaluronic acid also works beautifully with other ingredients. It's compatible with virtually everything: vitamin C, retinol, niacinamide, AHAs, BHAs. It can actually help buffer potentially irritating ingredients, making them more tolerable. Let's address some common questions about hyaluronic acid. Can you use too much? Not really. Your skin will absorb what it can use, and the rest will sit in the surface, which isn't harmful. However, layering multiple hyaluronic acid products may be redundant. One good serum is usually sufficient. Does it work immediately? You'll notice surface hydration almost instantly. Your skin will feel more supple and look more dewy within minutes. However, deeper, more significant improvements in skin texture and fine lines require consistent use over several weeks. Can it replace moisturizer? No. Hyaluronic acid is a hydrator, not a moisturizer. Hydration refers to water content, while moisturizing refers to preventing water loss and replenishing lipids. You need both for optimal skin health. Is it safe during pregnancy? Yes, hyaluronic acid is considered safe during pregnancy and breastfeeding. It's a naturally occurring substance in the body, and topical application poses no known risks. As we close our time together, remember that hyaluronic acid is one of skincare's true heroes. A gentle, effective, universal ingredient that simply helps your skin do what it already wants to do: stay hydrated, plump, and healthy. It doesn't force dramatic changes or cause irritation. It simply supplements what your skin naturally has but loses over time. This is skincare at its best, working with your body, not against it. Take a deep breath in and release it slowly. Consider how you might incorporate hyaluronic acid into your routine, or if you're already using it, appreciate the gift of hydration it's giving your skin. May your skin be deeply hydrated, plump, and radiant. May you choose ingredients that truly nourish and support you. May you find joy in this simple act of care. Thank you for this time together. Be well and be gentle with yourself. Welcome, and take this moment to breathe deeply and settle into peace. Tonight we're going to explore the double cleansing method, a gentle yet thorough approach to evening skincare that originated in Korea and Japan. Double cleansing isn't about being excessive or washing your face until it's stripped bare. It's about cleansing intelligently, removing different types of buildup with the right tools for each task. It's about being thorough without being harsh. Let's begin by understanding why double cleansing exists and what problem it solves. Throughout your day, your skin accumulates various types of buildup. There's oil-based buildup, sunscreen, makeup, sebum your skin naturally produces, and environmental pollutants that mix with these oils. Then there's water-based buildup, sweat, dirt, and water-soluble debris. These different types of buildup require different cleaning approaches. You've probably heard the phrase, like dissolves like. Oil dissolves oil, water dissolves water. Soluble substances. This is the principle behind double cleansing. A single water-based cleanser, no matter how good, struggles to remove oil-based buildup thoroughly. It might remove some, but not all. Remnants of sunscreen, makeup, and oil can remain on your skin, potentially clogging pores, preventing your nighttime products from absorbing and interfering with your skin's overnight repair process. This is where double cleansing comes in. The first cleanse uses an oil-based cleanser to dissolve and remove oil-based buildup. The second cleanse uses a water-based cleanser to remove any remaining water-soluble residue and ensure your skin is truly clean. Let's explore the first cleanse, oil-based cleansing. Oil-based cleansers come in several forms: cleansing oils, cleansing balms, and oil-based micellar waters. All work on the same principle, using oil to dissolve the oil-based substances on your skin. When you apply an oil-based cleanser to dry skin, it mixes with the oils, sunscreen, and makeup on your face. Massage it gently, and you can feel these substances loosening and dissolving. The oil breaks down even waterproof mascara, long-wearing foundation, and mineral sunscreen with ease, all without harsh rubbing or scrubbing. Here's the beautiful part. Most modern oil cleansers are emulsifying. This means when you add water, they transform from oil into a milky liquid that rinses away cleanly, taking all that dissolved makeup and sunscreen with them. No greasy residue remains. This emulsifying property makes oil cleansing completely different from simply washing your face with cooking oil, which would leave a greasy film. Emulsifying oil cleansers rinse clean, leaving your skin soft but not oily. The first cleanse is gentle yet incredibly effective. You're not scrubbing or tugging at your skin to remove makeup. You're dissolving it. This is especially valuable for your eye area, where the skin is delicate and should never be rubbed aggressively. After rinsing your first cleanse, your skin should feel clean, but perhaps still slightly filmy. That's okay. That's what the second cleanse addresses. Now let's explore the second cleanse. Water-based cleansing. Your second cleanser is your regular facial cleanser, a gel, foam, cream, or milk cleanser that's water-based. This cleanser removes any residue from the first cleanse, along with sweat, dirt, and any water-soluble debris your oil cleanser didn't address. The second cleanse is also where you can target specific skin needs. If you have acne-prone skin, your second cleanser might contain salicylic acid. If you have dry skin, you might use a creamy, hydrating cleanser. This cleanse is personalized to your skin type and concerns. After this second cleanse, your skin should feel clean, comfortable, and fresh. Not tight, not stripped, just genuinely clean. Your face is now a blank canvas, ready for your treatment products and moisturizers. Now let's discuss how to double cleanse properly. Step 1. Apply your oil cleanser to dry skin. This is important. Don't wet your face first. Your skin should be completely dry. Dispense the oil cleanser into your hands and apply it all over your face, including your eye area if you're wearing makeup there. Massage gently for 60-90 seconds. This isn't a quick swipe. Take your time. Use circular motions. Feel the makeup and sunscreen melting away. This massage time is crucial for thorough removal. Focus on areas where makeup and sunscreen tend to accumulate, around your nose, your hairline, your jawline. If you're wearing eye makeup, be especially gentle but thorough around your eyes. Step 2. Add water to emulsify. Wet your hands and add water to your face, continuing the massage. Watch as the oil transforms into a milky texture. This emulsification is the oil cleanser, binding with water so it can rinse away. Rinse thoroughly with lukewarm water. Make sure all the oil cleanser is removed. Check your hairline, jawline, and neck. Step 3. Apply your water-based cleanser to wet skin. This time, your face should be wet. Massage gently for 30-60 seconds, creating a light lather if your cleanser foams. Rinse thoroughly with lukewarm water. Make sure no cleanser residue remains. Step 4. Pat dry gently with a clean towel. Don't rub, pat. Your skin should feel clean, soft, and comfortable. The entire double cleanse process takes about 3 to 5 minutes. Yes, it's longer than a single cleanse, but the thoroughness is worth it. Who needs double cleansing? Anyone who wears sunscreen, makeup, or both. Even if you don't wear makeup, if you wear sunscreen daily, which you should, double cleansing ensures complete removal. Even people who wear just sunscreen benefit from double cleansing. Many sunscreens, especially waterproof or mineral formulas, don't remove completely with a single water-based cleanse. Remnants can clog pores and prevent your evening skincare from absorbing properly. If you wear heavy makeup, waterproof mascara, or long-wearing foundation, double cleansing is especially important. These products are designed to stay put. A single cleanse often isn't enough. Who might not need double cleansing? If you truly wear zero sunscreen and zero makeup, you probably don't need to double cleanse. A thorough single cleanse is sufficient. However, even people who don't wear products might appreciate the gentle, spa-like quality of an oil cleanse once or twice a week. Let's address some common concerns about double cleansing. Won't oil cleansers make my skin oily? No. Remember, like oil dissolves oil. Oil cleansing can actually help balance oil production. For oily skin types, oil cleansing might feel counterintuitive, but many people with oily skin find it helps regulate their natural oil production over time. Isn't double cleansing too much for my skin? Not if done gently with appropriate products. You're not scrubbing twice. You're using two different types of cleansers to address two different types of buildup. Done properly, double cleansing is thorough without being harsh. Do I need to double cleanse every day? Only at night and only on days when you've worn sunscreen or makeup. In the morning, a single gentle cleanse is sufficient. You haven't accumulated oil-based products overnight. Can I use makeup wipes instead of the first cleanse? Makeup wipes are better than sleeping in makeup, but they're not ideal. They require rubbing and tugging. They don't remove everything, and they often leave residue. An oil cleanse is gentler and more effective. What if I have acne-prone skin? Double cleansing can actually help acne-prone skin by ensuring pores are thoroughly clear of pore clogging residue. Choose non-comedogenic oil cleansers and a salicylic acid second cleanser for best results. Choosing the right oil cleanser. Look for products specifically labeled cleansing oil or cleansing balm. These are formulated to emulsify and rinse clean. Avoid straight oils like coconut oil or olive oil. These don't emulsify and can leave residue. For oily or acne-prone skin, look for lightweight oils like jojoba or grapeseed. For dry skin, richer formulas with olive or sunflower oil work beautifully. For sensitive skin, choose fragrance-free formulas with soothing ingredients. Cleansing balms are solid at room temperature, but melt into oil upon contact with your skin. They're lovely to use and travel well. Cleansing oils are liquid from the start. Both work equally well. It's personal preference. Choosing the right second cleanser. This is your regular face wash, chosen for your skin type. Gel cleansers for oily skin, cream cleansers for dry skin, gentle, fragrance-free options for sensitive skin. Use what works for your skin. The beauty of double cleansing is that it becomes a ritual, a way to transition from day to night. As you massage the oil cleanser into your skin, you're not hello and welcome to this peaceful moment together. Take a deep breath in and gently let it out. Today we're going to explore one of skincare's most versatile and gentle ingredients, niacinamide. In a world of complicated skincare ingredients with difficult names and harsh effects, niacinamide stands out as something beautifully simple. It's well-researched, well-tolerated, and works gently to address multiple skin concerns at once. There's no drama with niacinamide, no purging period, no sun sensitivity, just steady, reliable results. Let's begin by understanding what niacinamide actually is. Niacinamide is a form of vitamin B3, one of the essential nutrients your body needs. When applied topically to your skin, it works in harmony with your skin's natural processes, supporting and enhancing them rather than forcing dramatic changes. This is why niacinamide is so universally gentle. It's not introducing something foreign or aggressive. It's simply supplementing something your skin already recognizes and uses. Your skin contains natural niacinamide already. When you apply it topically, you're boosting those existing levels, allowing your skin to function more optimally. Think of it like giving your skin the tools it needs to do its job better. Now let's talk about what niacinamide can do for your skin. Its benefits are numerous and well documented. First, niacinamide strengthens your skin barrier. Remember, Your skin barrier is that precious outer layer that protects you from the world and keeps moisture locked in. When your barrier is strong, your skin is resilient, comfortable, and healthy. When it's compromised, you experience sensitivity, dryness, and various skin issues. Niacinamide helps your skin produce more ceramides, those crucial lipids that fill the spaces between your skin cells, creating a strong protective barrier. It's like niacinamide helps your skin make its own mortar to strengthen the brick wall that protects you. A stronger barrier means less water loss, better protection against environmental stressors, and improved resilience overall. Your skin simply functions better when its barrier is strong, and niacinamide supports that strength. Second, niacinamide regulates oil production. This is particularly valuable if you have oily or combination skin, but even normal skin types benefit from balanced sebum production. Your skin produces oil, sebum, for good reasons. It provides natural moisture, protection, and keeps your skin supple. But sometimes sebum production becomes excessive, leading to shine, enlarged pores, and breakouts. Niacinamide helps normalize this production, bringing it back to healthy levels. Interestingly, niacinamide doesn't strip away oil or dry out your skin. Instead, it works with your skin's natural feedback systems to regulate production from within. Your skin learns to produce the right amount of oil, not too much, not too little, just enough. Third, niacinamide reduces the appearance of pores. Now, let's be clear. Your pore size is genetically determined, and you cannot permanently shrink pores. However, you can minimize their appearance, and niacinamide helps with this. When pores become filled with oil, debris, and dead skin cells, they stretch and become more visible. When oil production is excessive, pores appear larger. Niacinamide addresses both these factors. It regulates oil production and helps keep pores clear, making them less noticeable over time. Fourth, niacinamide brightens and evens skin tone. If you struggle with dark spots, post-inflammatory hyperpigmentation, or overall dullness, niacinamide can help. It works by inhibiting the transfer of melanin, the pigment that gives your skin color, from the cells that produce it to the surrounding skin cells. This doesn't stop melanin production entirely, which would be harmful. It simply reduces excessive transfer that leads to uneven pigmentation. Over time, with consistent use, you may notice your dark spots fading, your overall tone becoming more even, and your skin looking brighter and more radiant. This happens gradually, gently, without any peeling or irritation. Fifth, niacinamide has anti-inflammatory properties. Inflammation is at the root of many skin concerns: acne, redness, sensitivity, premature aging. By reducing inflammation, niacinamide helps calm irritated skin and prevents inflammatory damage. This anti-inflammatory effect makes niacinamide particularly valuable for sensitive skin types. While many active ingredients can trigger inflammation and sensitivity, niacinamide soothes and calms. It's one of the few active ingredients that's truly gentle enough for even the most reactive skin. Sixth, niacinamide provides antioxidant protection. Environmental stressors, pollution, UV radiation, smoke, create free radicals that damage your skin cells and accelerate aging. Antioxidants neutralize these free radicals, protecting your skin from oxidative stress. Niacinamide offers this antioxidant protection, adding another layer of defense against environmental aging. While it's not a replacement for sunscreen, it complements sun protection beautifully. Seventh, Niacinamide can reduce fine lines and wrinkles. By supporting your skin's natural production of collagen and other structural proteins, niacinamide helps maintain firmness and elasticity. Over time, this can lead to smoother, more youthful-looking skin. This anti-aging effect happens gradually and naturally. Niacinamide doesn't force dramatic changes like some aggressive anti-aging treatments. Instead, it supports your skin's own repair and renewal processes, helping you age more gracefully. Now let's talk about using niacinamide in your routine. One of niacinamide's greatest strengths is its compatibility with other ingredients. Unlike some actives that conflict with each other, niacinamide plays well with almost everything. You can use it with vitamin C, retinol, AHAs, BHAs, essentially any other skincare ingredient. There's an old myth that niacinamide and vitamin C can't be used together. This has been thoroughly debunked. They work perfectly fine together and can actually complement each other's effects. Niacinamide is available in various product types: serums, moisturizers, toners, and treatments. The concentration typically ranges from 2% to 10%. Research shows benefits starting at around 2%, with most products formulated between 4% and 5%. Higher concentrations aren't necessarily better. Some people find that concentrations above 5% can cause slight irritation or flushing, though this is rare. If you're new to niacinamide, starting with a 4 to 5% concentration is ideal. You can use niacinamide both morning and night. It layers well under sunscreen in the morning and under heavier moisturizers at night. Many people apply it after cleansing and toning, before heavier serums and moisturizers. Because niacinamide is water-soluble, it absorbs quickly and doesn't leave a heavy or greasy feeling. Most niacinamide serums have a lightweight texture that layers easily with other products. Results from niacinamide take time. This isn't an overnight miracle ingredient. You'll typically begin seeing improvements in oil control and skin texture within 2 to 4 weeks. Brightening effects and improvements in dark spots take longer, usually 6 to 8 weeks of consistent use. The key word is consistent. Niacinamide works through steady, cumulative effects. Using it sporadically won't give you the full benefits. Incorporate it into your daily routine and be patient. The results are worth the wait. Who should use niacinamide? Honestly, almost everyone can benefit from it. It's one of the few truly universal skincare ingredients. If you have oily skin, niacinamide helps regulate excess oil and minimize pores. If you have dry skin, it strengthens your barrier and reduces water loss. If you have sensitive skin, its anti-inflammatory properties soothe and calm. If you're dealing with aging concerns, it provides antioxidant protection and supports collagen production. If you struggle with uneven tone, it brightens and evens pigmentation. Even if you feel your skin is perfectly balanced, niacinamide still offers preventive benefits, maintaining that healthy barrier, protecting against environmental stress, and supporting your skin's optimal function. Are there any downsides to niacinamide? Very few. It's remarkably well tolerated. Some people experience slight flushing with higher concentrations, but this is temporary and harmless. True allergic reactions to niacinamide are extremely rare. If you're using multiple products with niacinamide, that's fine. You won't overdose on it. However, if you notice any irritation, you might want to reduce the number of niacinamide-containing products in your routine. Let's address one common concern: niacinamide and niacin flush. Niacin, nicotinic acid, is a different form of vitamin B3 that can cause flushing. redness, and warmth. Niacinamide nicotinamide is a different form that typically doesn't cause this reaction. If you've experienced niacin flush from supplements, that doesn't mean you'll react to topical niacinamide. When shopping for niacinamide products, look for simple formulations. Niacinamide doesn't need a lot of fancy accompanying ingredients to work. In fact, simpler formulations often work better because there's less risk of irritation from other components. Store your niacinamide products properly. Cool, dark places are best, though niacinamide is quite stable and doesn't degrade easily like some other active ingredients. As we close our time together, remember that niacinamide represents everything good about modern skincare. It's evidence-based, gentle, versatile, and effective. It doesn't promise overnight miracles, but it delivers steady, meaningful results. This is an ingredient you can trust, one that works with your skin rather than against it. Whether you're addressing specific concerns or simply maintaining healthy skin, niacinamide supports your goals quietly and effectively. Take a deep breath in and release it
to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63: Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64: Acne in patients with polycystic ovary syndrome, PCOS, comprehensive management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 milligrams daily. Lifestyle interventions are particularly important in PCOS. Weight loss, even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65: Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines: fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside daily home routines yield better results than either approach alone. Professional treatments accelerate improvement and address concerns beyond what home treatments achieve. Frequency of professional facials depends on your skin concerns and treatment type. Most people benefit from monthly treatments initially, then maintenance every 4 to 8 weeks once acne clears. Discuss appropriate frequency with your esthetician or dermatologist based on your skin condition and treatment response. Professional facials can be expensive, but the results often justify the investment for moderate to severe acne or significant scarring. Many dermatology offices offer facials at reasonable costs compared to standalone aesthetic spas. Guide 14, Diet, Nutrition, and Lifestyle Changes for Clear Skin. While skincare products are essential for acne management, what you consume and how you live profoundly affects your skin. Understanding dietary and lifestyle factors allows you to address acne from internal and external angles simultaneously. High glycemic foods spike blood sugar rapidly. When blood sugar spikes, insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives: whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 mg daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin, and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important.